I'm going to show a release for the iliacus. The iliacus commonly gets lumped in with the iliopsoas. Iliacus and psoas are somewhat different. Iliacus doesn't insert to the lumbar spine. The psoas does for one major difference. And they have slightly different actions depending on if the movement's open chain or closed chain. So think of those as two individual muscles. So to palpate the iliacus, we have to go into the iliac fossa. She gives the giggles when I say iliac fossa. This is our third attempt. This is going to be our final attempt too. So we find the ASIS, the peak of the crest. I'm going to be about in the middle. The iliacus is a flexor and an internal rotator of the femur. So by having Kiki in this position, it's going to relax that muscle. So I can hold here and I can get my hook. So let me explain what I'm doing here, guys. Iliac crest, top, ASIS. I want to be right in the middle. So I'm going to hook under like so. So once I'm in this position, I can push Kiki's hip onto my fingers as opposed to digging in. So I can push her in here and I've got a hook now. I'm just hooking her crest here. And I can immediately rotate. That's going to further shorten the tissue. So for us to add some release, I can bring that leg down, release my hand, re-grip. And or we can come here and have Kiki open her knees and down 5 times. So this hand stays the same. Good, relax. I like to bring the client's leg up here. So we're flexion, and I can add internal rotation easier maybe. So I grip. So flexion, internal rotation shortens the iliacus, right? So I'm going to step back, externally rotate, forwards, step back, externally rotate. Makes sense? Flexion, short, iliacus, put my knee in, step back, extend, internal rotation. Here, internal rotation. If you're not happy getting in this sort of funky position with your clients, that's okay. You can put them down like this. Close and open. Close and open. So this is playing with the angle of rotation. I like to use my hip, or my knee, sorry, in the butt, just to stop her moving toward me. So I can go here, here. When you're doing this technique, you have to really have the clients relax. If they laugh, their abs and their obliques get fired up and it pushes you out of the fossa. Warn your clients it's going to be sensitive and it may bruise. It's very light, thin skin around the ilium. So just be cognizant of that. So iliac crest, peak, ASIS. Right in the middle, hook under. Shorten the iliacus. I can just come down this way. Drop, drop, extend, 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 and drop. Short, pin, left hand, bring her out into extension, drop. For me, this is my preferred way of doing it, just in terms of ease. I just have to just move my body, internal, external. I've seen other people doing different angles, but for me, this is just the easiest way of doing it. If you don't want to get so close to your clients for whatever reason, you can come into this angle here and have Kiki extend her leg, bring it back, release, extend your leg, bring it back. So what I'm doing here, guys, this hand is under the ilium. This hand pushes her ilium onto me. So I'm going to show you from the top of her shorts. So this is where I want to be here, and I'm pushing like that. So that's happening at a much less angle. So yeah, I can do it actually. So I'm here, and I push, hook, push. Here we go. So ASIS, peak of the crest, I'm here. So I get to about here, and I get stopped by the tissues of the abs, obliques, etc. This is the butt, and I push. Then when we get Kiki moving the hip, we're creating this type of motion with the pelvis. But I'm pushing here. Keep that down by your knees. So left hand is here. Here. ASIS. ASIS. Iliac crest. Iliac crest. My fingers are about here. My hand pushes the butt or the greater trochanter, pushing up and hook, and coming in here. Extend your leg, bring your leg back. So this is the Iliacus release. We will be showing other psoas releases too throughout the course of the academy. But this is just a great technique to work those deep hip muscles. Finally, we got through this video. It took about 6 takes.